Welcome, everyone. It looks like, wow, we've got quite a few folks here today. This is wonderful. Um, my name is Jane Fox. I am the project director here at Apt Associates for the ESCALATE Technical Assistance Project, working with NMAC, National Minority AIDS Council, as well as other partners. And as you all know, this is funded by um, HRSA and specifically the Ryan White HIV/AIDS program. So welcome to our Escalate meet and greet. You have all been engaged and working with your technical assistance coaches and with our subject matter experts to work hard in addressing HIV stigma in your organizations, in your clinics, and in your broader communities. The purpose of this meeting today is really for you to showcase all the great work that you've been doing and to also cross-pollinate so that you get to hear what your colleagues have been doing. And we really hope that this will be not only informational, but potentially a launching pad for you all to be collaborating and working together potentially in the future on continuing your work in addressing HIV stigma in your organizations and in your communities. So again, thank you all for being here. I'm excited to see all of your presentations, and I'm going to turn it now over to Sharon.
Hello, everyone. Great to see you all, and so pleased to have this opportunity to hear about the progress that you've been making on the goals that you set up to address HIV stigma within your organizations, and also to connect you all to each other, because all of the TA coaches have really heard from you all that this is something you're interested in. So we're going to do these presentations, but also note that there are two polling questions throughout the presentations where we're going to ask you what types of connections you're interested in making, whether it be you'd like to be connected to similar programs or you'd like to be connected to similar sites working on similar goals. So just a few housekeeping items before we get started. Please, since there are 10 sites, we really appreciate it if you could limit your presentation to 4 minutes. Everybody has been promoted to presenter so that when it is your turn to present on your site, feel free to unmute yourself as well as turn on your video, and you'll be brought to the stage. And also, since we don't know the transitions between your slides, just let us know as you're going through your presentation. Next slide, please. And the presentations are going to be in alphabetical order as shown on the slide here, starting with Alliance for Living and going through to Waikiki Health. And one more slide I want to show you all is this is essentially the groupings of the 10 different TA sites. We have state, county, and city health departments with Kentucky, New York City, Philadelphia, and Maricopa County. Then we have 2 federally qualified health centers. We have Waikiki Health. We have Waikiki Health and Southern Nevada. And then 4 community-based organizations, EOCIL, AFL, Step Up, as well as Diverse and Resilient. So these are kind of how we see the similarities between the sites. And without further ado, I'd like to turn this over to Alliance for Living to present on their program.
And thank you, Sharon, and to all of you who are joining in today in this meet and greet. It is the absolute pleasure and honor to start this off today to talk about our agency, Alliance for Living. We are located in Southeastern Connecticut, and we are the only AIDS service organizations and resource center in Southeastern Connecticut that also deals with the following services: homelessness and substance use disorder. We are a group of dedicated staff and professionals who are passionate about helping the people who are in our community. And this opportunity of Escalate has given us a chance to truly review and nurture our HIV services and then scale them to a point that we can, as its name says, escalate and grow. We have all been through the times of 2020 and 2021 where we, as a nation, as a worldwide, suffered through a pandemic, and really our services after the pandemic needed to change. So this opportunity has given us a time to be able to really review all our services and truly review the core of what we're doing and taking the chance to um, find ways to scale them up. So as you can see on our slide, we have a very specific slide. We want to just go right into it. I want to go over and mention our team members of our group. Part of our team from LFL, we are really incorporating a lot of our staff. So everyone who's involved within our HIV services. So it includes myself, Frank Silva, as the Director of Community Care and Administration, Xavier Day as our YMY Coordinator, Megan Davidson as our Housing Coordinator, Hannah Patrick as a Medical and Housing Case Manager, Amanda Desorciers as a Medical Case Manager, our Treatment Adherence Nurse, Eileen Holdridge, and our medical nutritionist, Tara Smith. Our mission statement is the following. Our Alliance for Living is at the forefront of implementing evidence-based client-centered care to address the public health with a focus on HIV, homelessness, and the overdose epidemic. As a progress and as what we can describe around our team, really the ESCALATE time that we have had has truly been so fast this past 5 months, but giving us a chance to truly, like I said earlier, review our services. It has, I think, the biggest accomplishment that we can really credit to our time in allocating the time to ESCALATE really has been to understanding and knowing our audience. And we have known that we have 3 different sectors that we have to focus our work with when we're talking about HIV and reducing stigma barriers. The first circle is our clients and the people that we are serving. The second circle is our staff and the people who are doing this work. And the third circle is the community at large. So by knowing those circles and the audiences, then we can then review the following goals that we plan in really developing plans. Our plans are that we're growing and reviewing how we're addressing those 3 different circles of audiences and increasing education, increasing policy, and also content materials. So we have selected out of those different circles of focus a goal to address to that audience. And as moving forward, and as the next step for moving forward as on our plan, and especially on this workload, we will expand those goals into the different audiences. As where we are right now, we have focused our education goal for our staff. But moving forward, we'll be increasing our education for our clients and community. We are focusing our policy work for clients, but we'll then follow through with staff and the community at large. And content materials, we're working on producing materials who are reviewing and sharing our services, inclusive of all the services to the community. But we will then work around materials that have to be within the audience of clients and also for the audience of staff. And that's our agency in a very brief moment of a description. I see some of our staff, and I want to highlight Xavier Day, who is our YMY coordinator. I see Hannah Patrick, which is our medical case manager, who are here today, and also open up the room at this time for you if you have any questions. Thank you.
Thank you, Frank. Okay, so we're going to move on to diverse and resilient.
Hello, beautiful humans. I'm Justin Roby. I have the pleasure of serving as the Director of HIV Care here at Diverse and Resilient. This is a relatively new program. So we have a peer navigation program. It started about 2.5 years ago, right before the pandemic, and then has been reshaping our program. So ESCALATE felt like a great fit for us to move forward with as we continue to integrate a HIV care program into a facility who has only done testing previously and done anti-violence advocacy work. So this Escalate technical piece, so it's 25 years we've been existing as an organization here in Milwaukee. Our staff is primarily people of color, so it's very much an empowering organization to work for. So our stigma reduction / elimination team was comprised of people from our HIV care team, from our STI HIV prevention team, and from our anti-violence programs. So we had a multidisciplinary lens as we approached what we wanted to do as far as reducing stigma here at Diverse and Resilient. And so we planned two major goals, and that was to create an HIV stigma reduction / elimination policy that operated on a systems level, and then to build a training that would complement this policy for implementation within community, within our organization, and within medical settings. So right now, I can say that we are in the final stages of that policy. We are fleshing out some of the actionable items that we can do to coincide. So we commit to disrupting any environment that people living with HIV feel like they are being stigmatized in. So how can we do that, and how are we showing up to support that and disrupt that? So we're fleshing out a little of those final details for the policy piece, and of course the training will follow suit from that point. So really excited to see what that's going to look like for us in the coming days, and get that information to some of the local conferences here in Milwaukee and the surrounding area. And next steps for us is to create an evaluation plan that is rooted in dignity and cultural competency. So we want to make sure that what we use to evaluate this policy and the way that we're employing it here at Diverse and Resilient. One is about dignity, right? So that we know that we are giving space for people who have not gotten space before, and recognizing that we have done harm historically, unintentionally, and what does that look like as we move forward? So really excited to see what that process is like, and I pass this off to the next presenter.
Thank you so much, Justin. Eastern Oregon?
Hello, everyone. My name is Kelly Rumsey with Eastern Oregon Center for Independent Living, and I am a part of the stigma reduction team here. And on our first slide, you see there that it says Jeffrey Williams. He is also a member of our team, but unfortunately, he and our CEO, Kurt Toombs, are unable to be with us right now as they are on a very important grant meeting. So they stepped away for this. But again, I'm with Eastern Oregon Center for Independent Living, and my name is Kelly. Next slide, please. So EOCIL's mission and services, we have several different offices throughout Eastern Oregon. We have a location in Burns, Oregon, Ontario, Oregon, which is where I'm at, Pendleton, Oregon, and the Dalles, Oregon. And we are also looking at getting office spaces in the LeGrand area. So within Eastern Oregon Center for Independent Living, of course, we are an independent living center. We provide services which can consist of HIV community services, which is Ryan White case management, cultivated housing, insurance assister services, and HIV prevention services, which also includes syringe exchange. Also under our roof, we have the Independent Living Center, where our individuals are able to meet with clients in the area and provide referral and advocacy services, as well as we support the Two-Spirit and LGBTQIA resources in our area, disability support groups, disability youth mentoring, and peer-to-peer mentoring. Next slide, please. Our EOCIL stigma team consists of myself. Again, I'm Kelly Rumsey, and I am the program director for the Ryan White HIV case management program. We also have Jeff Williams, who is the director of the cultivated housing program. Ashley Jones, who is a housing coordinator navigator located in our Pendleton office. Crescencia Witherspoon, who is the director of our HIV prevention program. Myself, of course. Heather Blagg, who is our ACRN lead nurse. Amador Perez, who is an HIV prevention specialist. And then Kurt Toombs, who is our CEO. It's hard for me to see these, so just 1 second.
Just a quick time check, Kelly. You have 2 minutes left.
Thank you.
Mm-hmm.
So our work plan is we wanted to structure our policy to revise our HIV Community Services Policy 610. Also to revise our Total Quality Management Plan, work on our marketing, social media, and website, which is now completed. We also wanted to identify community partners where we could reach out and present our stigma reduction PowerPoint presentation. We are also reaching out to our local CCOs, health departments, and other programs that we work with. Just wanted to get our name out there and then also work on presenting our PowerPoint that Chrissy and Ashley have put together for our stigma reduction. Next slide, please. And our continuation plan consists of, we are applying for the ESCALATE Learning Collaborative, continue full policy and procedure manual review, enhancing our quality management policy to fit EOCIL's stigma reduction plan, continue to offer peer mentoring to other community partners, educate all existing EOCIL staff and new incoming staff on our stigma reduction plans and services, and continuation of stigma reduction education outreach to community partners. And we at EOCIL cannot thank our team members from ESCALATE enough. You guys have been amazing, very supportive, very informational, and we respect you guys so much. Thank you.
Thank you, Kelly. Moving on to Kentucky Department of Public Health.
My name is Gloria Dennis. I am the Ron White Part B Program Manager for Kentucky. The next slide, please. The Kentucky for Department of Public Health. Our Kentucky Ron White Part B Services Program is housed within our HIV section, and our stigma team consists of Tisha Johnson, the HIV/AIDS Medical Director, Supervisor, Christy Perry, which is our ADAP Coordinator, Gloria Dennis, which is myself, the Ron White Part B Program Manager, and Tiffany Bibbins, which is the KHCCP Administrator, which that stands for Kentucky Health Continuation Care Coordinator Program. Our goals is to revise our Part B grant application to increase inclusively for all people on the gender spectrum. Our progress, we have met with the ADAP administrator to review current application and making changes in areas with gender identity, currently in the final stages of editing the application. Our next steps are, once the edits are completed, we're going to invite persons from the transgender community to review and provide feedback. We're going to test the new application with a subrecipient for about 2 weeks. And then we're going to incorporate the feedback, roll out the new, more inclusive application to all subrecipients at all the staff meetings that we will hold in July of 2022. Post TA goes, we're going to continue to work towards reducing stigma within our program and across the state. Thank you.
Thank you, Gloria. So you should be seeing responses to this polling question, which I referenced at the beginning. Essentially, we want to know if you all are interested in connecting with similar programs. And as you saw from this slide earlier, the way we're grouping the programs, the TA sites are state, county, city health departments, federally qualified health centers, as well as community-based organizations. So if you could just take just a few seconds here and let us know if you're interested in a follow-up sessions with programs that are similar to yourself. You'll be able to learn more in a more intimate, smaller group, hearing about some of the specific goals and the challenges and some of the solutions that you've developed. So if everybody could just input their responses now, we can then move on to the remaining presentations. We'll just give it another 10 seconds or so. Okay, and make sure that you answer the poll on the right-hand screen. Okay, so let's close the poll at this point. Thank you so much for responding to it. We will collect that information and move forward with those smaller groups, depending on the expressed interest. Okay, so we are going to move on to Maricopa County. I think you're muted. Fabulous. We can hear you now.
Okay. Thank you. So I'm with Maricopa County. My name is Shantae Coleman. So for our next slide, please. For our stigma reduction team, consists of both Running White Part A and Part B recipient staff, as well as members from our planning council. Next slide, please. Our first goal was focused on our Positively You media campaign. This media campaign is geared to inform young adults living with HIV/AIDS, 18 to 30 years old, to proactively link to treatment, retain, and maintain viral suppression, as well as familiarize them of Running White services. The campaign features residents from Phoenix who volunteered to tell their stories on the web, via social media, and even also printed materials. We wanted to create an evaluation plan to measure the impact of the Positively You on HIV stigma. So this review was done in 3 parts. And this would be our first one was the experience evaluation of campaign participants. So we are going to be conducting our first focus group in July of 2022 to get that evaluation. As well, again, we're going to have our second focus group with our second group of ambassadors or participants in September 2022. Qualitative data collection about the campaign at future events. So we're planning on implementing that in the fall of 2022. I don't know if those have been to Phoenix. It's extremely hot in the summer. So we're going to return with our outdoor communities back in the fall when it's much cooler, for example, like Phoenix Pride. The quantitative data collection via Google Analytics, this is going to be an ongoing measurement of engagement with our social media via like Facebook and Instagram and our other website engagement and paid ads. Next slide, please. So for our goal number 2, actually, we have this as include our cultural competency and cultural humility component questions in our existing organizational assessment. Annually, we review the progress of our providers' organizational assessment, and so our goal is to implement some of those questions into their current organizational assessment. We are still reviewing the questions that we like to include for the organizational assessment. One of the challenges that we encountered is while we were brainstorming and creating these questions with the SME, we realized that technically this should be our goal number 3 instead. So we kind of went out of order and we couldn't figure that out until we were actually in the process. So go ahead to the next slide. So for our goal number 3, which is now goal number 2, we need to create and disseminate a toolkit of strategies for our providers. So provide the training so that they know what they're looking for, and then we will eventually incorporate those cultural humility and cultural competency questions into their organizational assessment. And our goal is to implement everything by the end of this year. So that is where we are, and I think that is it.
Thank you so much, Shanti. Okay, moving on to New York City Department of Health. You're on mute, Joe.
I'm sorry.
There we go.
Okay, sorry about that. This is Jill Williams from the New York City Department of Health. I would just like to say that we've done some great work. The challenge is that we are an agency that employs 6,000 people, and most of us come from the Bureau of Hepatitis, HIV, and Sexually Transmitted Diseases, which is about 700 people. So what I'm excited to tell you, though, is that we have a really diverse team. And you have the names on the screen here. Julia Cohen is from the Business Systems Unit of BHHS. Billy Fields, who's texting me because he can't join the meeting, is from the New York Planning Council. Linda Hakeem represents the Westchester County Department of Health. Kimberly Mack works with the Planning Council under the Bureau of Hepatitis, HIV, and Sexually Transmitted Disease. Grace Maxson is from the Research and Evaluation Unit, and Dalvia Panacea is from the Health Equity team. And I'm from the Quality Management Program and Implementation team as a trainer. You can go to the next slide. So our goal number 1 and our progress is that we wanted to define stigma, develop an anti-stigma framework, and incorporate that framework in BHHS culture by committing to offering and promoting anti-stigma trainings with the framework as a calling card to promote training. Currently, we are developing this framework with our subject matter experts that will incorporate New York City Health HIV stigma, examples, data that supports those examples, and interventions of existing work with stakeholder support. Also in progress is we are in development of a presentation to promote the ESCALATE training and other anti-stigma, HIV anti-stigma trainings. The next slide. So goal number 2 is to collaborate with stakeholders and service providers to support the provision of the ESCALATE training via select activities. One being the most important was to gather data from an organizational assessment. So we are in the progress of participating in a pilot study with TRX Solutions that did the ESCALATE organizational self-assessment that we all took after we did the training. So we're going to do a pilot with them, and then we're also going to ask our funded providers to participate in a pilot. And the hopes is that we'll develop a toolkit so that once they can see their assessment of how they're doing, that they might be interested in the training. And we will support them in applying for the ESCALATE training, perhaps developing a toolkit to assist providers with that application process. Also internally, which is the first bullet, is that we are going to internally develop an assessment, an organizational assessment that focuses on a trauma-informed lens across BHHS. The next slide. Our goal number 3 is to examine collection of Ryan White data with an anti-stigma lens. So for our Department of Health, this might be of little of interest to you, and for those programs that have Ryan White funding. So we're going to make recommendations to HRSA regarding collection and reporting of Ryan White data elements in order to reduce stigma. I saw one of the other Department of Health is doing something I think similar in terms of language. Initial communication currently with leadership with the HIV/AIDS Bureau to discuss those recommendations. Initial communication with the DISQ team that supports data collection for HAB. So we've got some inroads with initial activities to support the bullet for with HRSA. And then lastly, plans to meet with the New York Planning Council Data Work Group about our recommendations. And I think that's it for us. Yeah, so our TA goals are to expand goals across the Bureau of Hepatitis, HIV, and Sexually Transmitted Infections, again, which is under disease control within the entire Department of Health. That's where the Bureau of Hepatitis, HIV, and Sexually Transmitted Disease falls. So it's huge, and we're trying to break down all that red tape and make some inroads. Thank you.
Thank you, Jill. Okay, moving on to Philadelphia, Department of Public Health.
Hi, everyone. It was so nice to see my former colleagues just before me. I'm Anna Thomas Ferrioli. I'm the Ending the HIV Epidemic Advisor at Philadelphia Department of Public Health. And I'm here to talk a little bit about what we are doing. I just prepared one slide, so I'll be talking around the slide a little bit. So our project and our team crosses over the Philadelphia Department of Public Health AIDS Activities Coordinating Office, or ACO, which is a division within the health department, and the Ambulatory Health Services program, which is another division which within the health department, which also runs neighborhood health clinics, which serve as safety net providers around the city. There are about 10 of them. And so our team includes Adam Williams from AHS, Dr. Kwakwa from AHS, Deja Alvarez from AHS, and then from ACO, our team has included Tia Williams, Gregory Siniadiano, Micah Thomas, Tanner Nassau, and Afra Howlitter, who has been working with us as an urban health policy fellow. So we're a really pretty large team that works over across two big divisions. And we are working together to implement an anti-stigma project at the AHS Safety Net clinics. So our TI goals are to select a pilot site using an evidence-based approach and to develop a stigma assessment tool that we will be using with the pilot site to have a baseline understanding of stigma experienced at that site so we can develop and implement appropriate evidence-based interventions that align with the experiences of stigma happening at that particular site. The populations from site to site do vary some as they mirror the demographics of the parts of the city in which the clinics are housed. We've made some progress towards achieving our goals. We have identified a pilot site, but have not yet confirmed it. We are still in some negotiation about whether this would be the pilot site or one of the other sites we had discussed would be the pilot site. And we have collected and reviewed sample stigma assessment tools, but have not yet codified one, which would then be carried out with the pilot site. Post TA, we plan to carry out the anti-stigma work at the pilot site. And then once we have one pilot site through a cycle, we plan to disseminate the anti-stigma activities, starting with an assessment again at the other AHS clinics throughout the city. That's it. Thank you.
Thank you, Jill. Sorry, Anna. Okay, moving on, we have a second polling question. Would you be interested in connecting with another TA site working on similar ESCALATE TA goals, such as modifying policies and procedures, developing and disseminating HIV promotional materials, as well as others that I've listed here? I'm going to give you all just a little bit more time so that you can review the different options and respond accordingly. Okay, it looks like about half of the people have responded. We'll give it about another 20 or so seconds. And I want to encourage you all to post questions in the chat, because if we have time at the end, and you can post them to a particular site, if we have time at the end, we'll try to address those. So if something has come up in their presentation that you'd like to know a little bit more about, or you'd like clarified, feel free to put that in the chat. Okay, we'll give it another 5 or so seconds. All right, let's close the polling question. And we are going to move on to Southern Nevada.
Good afternoon. My name is Crystal Montgomery, and I'm with the Southern Nevada Health District. We are the local health district in Las Vegas for Clark County, which is pretty much Las Vegas, but the surrounding areas as well. And our stigma reduction team is based on our staff that's at the FQHC, which is Marilyn and Albert, Keanu, Denise. And then they did invite us, we are the health equity team division at Southern Nevada Health District. So that would be me, Cynthia Boleyn, and Xavier. And then we have another counterpart, which is Rachel Hobart, and she's with our Division of Office of Disease Surveillance. So those are basically how we formed our team, and we formed it back in February. Next slide, Sharon. So our team consists of health educators and health workers from our Ryan White Health Equity and Office of Disease Surveillance. And our Rapid Start program within the Ryan White program focuses on patient-centered services, and we allow same-day medication, additional labs, testing, eligibility, and case management services at the clinic. And we also developed a plan to address stigma by understanding our facility's learning needs and creating components to address stigma at multiple facets. So really, as our team, we're just trying to focus on how we can improve and really try to reduce stigma within our staff, but also with our patients as well, and improve the patient experience. Next slide, please. So what we're doing and where we've gone and where we are going. We just got back from the ESCALATE training in Dallas, which was amazing. We got a lot of great materials and learned a lot. So far, what we've been doing is we've really been addressing workplace the culture at Southern Nevada Health District. What we did is we did a survey that we sent out to all clinical staff to start with, and just to understand their beliefs and their knowledge and patient experiences surrounding HIV and helping patients living with HIV. And then also we collaborated with our leadership for the surveys. We've also implemented some survey questions at the end of our patient survey that is surrounded around HIV stigma, so we could get the patient's perspective as well. And we are also looking into formulating recognition into reducing stigma, so we can recognize those anti-HIV stigma behaviors that people display at work to kind of reward the great things that they are doing instead of just try to go at it from a negative approach. To really make our employees feel good and want to kind of spread that positive energy in our work environment. We're also developing promotional materials for our patients to give them also, as well as for their families, and making it really visible around our clinic and around the health district as a whole, so that people can see that we're trying to reduce HIV stigma and educate people in the community about it, as well as let them know we provide those services. Because a lot of times here in Southern Nevada, people just think all we do is health cards, that people need to work, in the food industry or serve alcohol. And so they're not aware as much of all the services our health district does provide the community. We're also looking into developing training that we can take to our staff just to create an understanding of HIV stigma and how to address it, and really to have a holistic lens for health, as well as more of an equity lens to help serve our community and our patients. And we're also developing a toolkit that we can provide our staff so they can find resources to learn more about HIV stigma and to just utilize while they're working, from the doctors to the front desk staff to just anyone that has that patient contact. Next slide, please. So this is our contact information for our team. So we are a team of 9. And we'd definitely love to partner up or join with some of the other groups to just get ideas and just learn more about what you all are doing. Because there's, you can always learn from others and get great ideas. So we really appreciate just being here and just be able to hear about what your organizations are doing.
Thank you, Crystal. And we'll be sending the deck out to everybody. So thanks so much for listing your contact information. But we'll share with the rest of the group if it's not listed on a slide. So next up is Step Up.
Hello, my name is Sharika, and I will be presenting for Step Up. So Step Up is a community-based organization based in Indianapolis, Indiana. We were founded in 2003 by two individuals that were impacted by HIV and saw how it was affecting our community, so they wanted to do something about it. We are approaching our 20-year anniversary here. We have gone from two employees in the organization to about 30 staff right now. And we do offer a variety of services, including HIV and hepatitis C care coordination, testing, education, outreach, and prevention. And we also have a reentry program that works with individuals that are currently incarcerated and who are leaving incarceration. Next slide, please. So our stigma reduction team is comprised of almost everyone one from the different programs in our organization. We have Todd Lair, he's our president and CEO. Hannah Kistler, she's our director of HIV client services. We have Manuel Gonzalez Carrasco, he's a non-medical case manager. Lydia Port, she's an outreach and testing coordinator. Mara White, she's our quality manager, and then myself. I am the HIV Client Services Program Manager. Next slide, please. All right, so here at Step Up, we were working on 4 goals with our TA coaches and SME. So our first goal was to standardize hiring practices in order to diversify the candidate pool, increase the number of qualified candidates who reflect the communities Step Up serve, and increase employee retention. So Step Up doesn't really have an HR department, so all of like the recruitment, job posting, and HR related activities fall on us in addition to what we do every day. So in the historically, like hiring for positions have come from word of mouth. So that has led to a not so diverse staff that reflects the community that we serve. So we would like to change that. So we have done some outreach to other organizations. We've created a list of organizations where we can send those job postings to, and we are still gathering, building on that list. So if you know of any organizations where we could send job postings to, that would be greatly appreciated. For goal 2, we working on updating our client satisfaction survey to collect data on stigma and broaden to include entire agency. So we send out a client satisfaction survey each year around December, but right now there are no questions related to stigma on that. So our quality manager has been working on that, and our subject matter expert has sent us a number of resources that we've taken into consideration. That survey has been updated and has been submitted internally for feedback. So hopefully we'll have that ready when it comes out in December. We're also, for goal 3, we're updating our current policies and develop new ones as needed using a stigma reduction lens. We are a pretty small organization, but we're also siloed. So sometimes we don't know what our other programs are doing. So we have collected most of those policies and procedures from each of our program, and we are putting them in a shared drive. We will be, once all those are collected, we'll be looking at those with a DEI lens just to make sure there's no stigmatizing language. And then we'll also be seeing what we have, what we don't have, and then making some new policies from there. For goal 4, we would like to ensure that our social media and website expresses our values and contains appropriate language. We do have some members from our ESCALATE team and also our DEI committee on that, on our social media committee. So anything that's going to be posted will go through them, and they'll review that and make sure there's no stigmatizing language there. Next slide, please. So for our post-TA goals, we're going to continue to work on our current goals. continue to look at everything through an equity lens when making our organizational decisions. And we do plan on applying for more TA after this is over. And I think that's it.
Thank you so much, Sharika.
Thank you.
And there's your thank you. Okay. All right. Next up is Waikiki. And even though we have 14 minutes and Waikiki actually has quite a few slides, we are not going to take 14 minutes on Waikiki. We're going to either do a Q&A or we're going to break out. We're going to move into smaller breakout sessions. All right. It's all yours, Kevin.
Hi everyone, I'm Kevin Patrick, and I wanted to give you some context about Waikiki Health. We're probably about the third largest FQHC in Hawaii. Next slide, please. Next slide. Oh, thank you. Just some pictures of our facilities. Next slide. So we're about the third largest FQHC in the state, and we do, however, take care of the most HIV patients of all the FQHCs, probably about 200 patients. So we have by far the largest number of HIV patients in the state. We have no public health clinics in Hawaii, so most of the patients are seen either by private practitioners or by larger clinics like ours. For context, our clinic serves about 46,000 patients in a year for visits. Next slide, please. We too are kind of in silos, so it's kind of a visual representation of the various sites we have. This is the southeast shore of Oahu. Our sites are scattered over several miles along the southeast shore. Next slide, please. Our PATH clinic provides services for pregnant women with substance use disorder. That's kind of near the foothills of Diamond Head in a very picturesque place. So it's a very helpful place for also women exiting domestic violence situations. Next slide. We also have a youth outreach center right in the heart of Waikiki, and they offer a variety of services for young people who are unhoused or in transitionary positions between the community and their homes. Next slide. Our shelter, New Beginning Keho, is where I'm actually located now. We have about 75 spaces for clients here. It is dormitory style, and we are in high demand. We rarely have a vacancy here. Next slide. And right down the street from us is our newest clinic where we have oral health care, and we have the largest dental clinic for people with HIV in the state of Hawaii. That is a very high demand service. It's heavily needed in Hawaii, and we're grateful that we're able to provide a very good and large dental clinic for people with HIV in the Honolulu area. And people come in from across Oahu for care there. Next slide. And our main clinic is actually in the heart of Waikiki and provides comprehensive services there. Rather older building and kind of back in the between the Waikiki Beach and the kind of start of Honolulu proper. Next slide. So we're real excited to be a part of ESCALATE. It gives us an opportunity to kind of review and work on our front-facing as well as internal documentation to kind of work on destigmatization review of policies and procedures, as well as how we interface with clients. Next slide, please. We hope to infuse the new orientation hires with anti-stigma best practices. We're currently reviewing workflows and language for stigmatizing language within the paperwork and documentation we use. And we hope to do a comprehensive walkthrough of the various sites alluded to in the map previously. Just look at the clinic as it presents to clients whenever they first interface with us to try to get a fresh perspective of how they may experience stigmatizing components entering our facilities. Next slide, please. Our challenges are the customary time, the shortages of trying to carve out time for the process. We've had staff transitions, again, no big surprise there. And so we have to kind of make sure that we stabilize the process so that it can kind of survive the transition of people moving through the clinic hiring process. Next slide, please. And our successes really rely on the long-term staff that has been here for 20 years or more, who are really dedicated to working on improving patient satisfaction and quality of care. And I think ESCALATE has given us a fresh perspective of looking at how we do provide services to kind of recalibrate and to kind of refresh our views and kind of go back and start at square one and make sure that we're in line with best practices for destigmatization with our clients across the board. And we're really appreciative for all the information we've gained from the trainees and the support staff, and also from the other people who have been presenting today. So thank you. And just wrapping up with the post-TA goals, just trying to move forward on schedules of work with everyone in the process and coordinate team actions. I think that's it.
Fabulous. Thank you so much. Thank you all for presenting on your programs. I hope that everyone got a little taste of each of the programs. And thank you for responding to the polling questions. I only see one question in the chat, and I think that Kevin Kate provided an email address so that you could connect with her. We are going to move into breakout sessions right now, so that for the next however many minutes until we have to the end, from the start of the breakout sessions, we're going to put you all in groups according to your organization type. So the state, county, and city departments of health are going to be together. The federally qualified health centers are going to be together, and the community-based organizations are going to be put together. And our incredible event support staff is right now putting us all into breakout sessions. So once you're moved, this is going to be the last time that, right here is going to be the last time that we're going to be all together. I want to highlight that we have another office hours coming up at the end of the month. You all should have gotten a notice about it, and essentially it's addressing stigma directed to people who were previously incarcerated. So I hope that you attend that. And if you're not able to, then you will receive the recording regardless, and you can watch that later. So Kayla, whenever you are ready to move us into breakout sessions, feel free to do so.
So we will actually have folks self-select their breakout session according to site type. You should, on the bottom right-hand side of your screen, have a person icon. If you click on that, you should see the list of breakout sessions and can click the join button. I can see some folks are popping in now, next to the site type that applies to
Where now? Sorry, bottom right side.
No
Okay.
problem. Yeah, bottom right side. And it's shaped like a little person. If you click that, then you should see a list of breakout sessions, and you can click the join button right next to the site type. If you need help, I will remain in this main room to assist. And I know that we have at least one, or we did have at least one call-in user, but they may have left the meeting. Looks like they did.
I'm just saying participants, sorry.
No worries. And that's Kimberly?
Yeah.
Yes, same here.
No
Yes, and
problem.
same here for Kelly.
Same
No
here.
No problem, everyone. We'll get you where you need to go.
So for some of us, it's if you click participants and you show everyone, it's under a blue hyperlink that says show all breakout sessions. It's not a person for some of us.
Thank you. Fabulous.
You're welcome. Yeah, I just happen to be clicking around in the chat room. Under participants, it says breakout sessions have started. There's a blue hyperlink that you can click it and click your field that you best identify with.
Thanks, Xavier.
You're welcome.
Oh, like I have OCD or something?
Like bunny. And I come back. I always thought it was crazy. I put a little.